Cheers.
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 To
Welcome.
Coffee. Yep. Welcome.
Sorry.
Nope. To coffee and childbirth.
Yeah, to coffee and childbirth.
We have an obvious visual guest with us, and we may have some interjections or information from an off-screen guest as well.
Yes.
We are
small human.
We are parents, dog parents. So
Yeah.
that's
Human
just what
parents.
happens. Human parents, you know.
Mm-hmm.
So, yeah. So I wanted to, please wait. Dr.Rhee and I wanted to talk a little bit about, since April is C-Section Awareness Month, if we have a client that comes to us or we know a mom who has had a C-section in kind of the early phases, how would we support that? And then potentially if they're pregnant again with a C-section scar, et cetera, and in that history, how would we support that way?
Okay.
So we can take like the acute or the early version.
Stages.
Yeah, go ahead and if you have.
Well, I mean, as a chiropractor, I'm just trying to think back over the years.
Mm-hmm.
Gosh, definitely lots of C-sections over the years.
Like the prevalence, how often it happens. Mm-hmm.
Yeah. I mean, the first thing that comes to mind is just the healing process.
Yeah.
Right. And some of the concerns that a lot of patients have for chiropractic is that one of the first main questions that I get is, how soon can I come to get adjusted, right, after a C-section? Mm-hmm. And obviously, it kind of depends on that individual's healing rate, right? So some people heal really quick. Some people heal much slower. But also, I think the technique of the C-section, right? So certain doctors have different ways of going about the C-section. And then also the patient's condition, is their first C-section, right? Is it a fresh wound or is it a C-section that was obviously done in the same area, same region, and or a different technique? So I think it really varies on so many different, which is pretty much how it is with any kind of human condition, right? Because individually we heal differently, and technique, and they're also own immune system and their own history. And then obviously, if someone has keloids, right? And so there's so many factors. I think the biggest thing is a chiropractor. I think the first thing that I kind of wonder is, what is your strength capacity, right? Before the C-section, I'm curious,
of your core musculature,
of your core, pelvic health,
hip,
right?
Of all of those things.
Yeah, I mean, were you a sedentary person for many, many years, or were you very active and you have an anti-inflammatory diet, lifestyle,
or lymphatic drainage is kind of 100%, on a good routine, and it knows what to do.
Correct. Yeah. So all of those things are what I'm curious about, because I don't think it's good to treat that person the same way with any other, right? You can't be like, oh, you got a C-section, so all the C-section moms are going to be treated in this manner, which is XYZ. So I think that's a bad approach. Obviously, I think you and I both can agree that we really like to look at the individual and what they need when it comes to any kind of care.
Absolutely.
So in chiropractic, it's just really boils down to your ability to handle that level of trauma, because I still see that as trauma. We can talk about the emotional part of it, mental part of it, of course. Unplanned.
So an unplanned C-section versus a planned C-section.
Correct.
You know that you're going into this.
Correct.
You've had inducement, you've had induction, and then or spontaneous vaginal labor. So you've been laboring, and then a C-section happens. So yes, all of that trauma that's outside
all of those
of
things. So I guess my answer to all those patients that ask that question is, it's when you feel confident to come back for an actual physically kind of a physical type of care, because chiropractic is still, I still have to move you around.
Lay on your belly.
It's still passive care, meaning I'm doing the work and you're passively laying on my benches or tables, I should say.
Mhm.
But you still are going to be moving around from table to table, right?
Yeah.
So I think that's my biggest reason, like how do you feel ready to come out of your house, first of all?
Yep.
Right. Number two is like, do you think you can handle moving around?
Yeah.
So those are some of the things that I ask.
Yep.
Right. And we have a little sneakery.
Oh, do we have a friend who would like to join us?
Are you going to join us?
Okay. You have to sit on my lap and we have to have really good listening.
Yes.
Like the best.
Will you be able to listen to my stories and mommy's?
The best you've ever had.
Okay. Awesome. So, so that's what I usually kind of like go for first. And then the actual process of the adjustments. I love that we both have our little ones.
Our lap dogs.
Our lap dog. Lap human. And
lap human dog. And our lap dog. Yes. So when it comes to, like you had mentioned with the passive care or what they're coming to see you, right? Because they're traveling to your office.
Yep.
So like if I'm thinking about a 2-month, I almost said 2-month-old, 2-month postpartum.
Yeah.
So like 8 weeks, 2 months postpartum mom. And she has the same question of like, well, when could I see PT? It would be, okay, well, if I'm coming to you, there's a lot of supportive work, completely appropriate, that I would be coming to you to monitor the wound care in addition to what your OB is saying as well. Because that's what they're mostly worried about is the wound care and the surgical part of it.
Yeah.
So that's where I would say, okay, that could be a 6-week time. That could be an 8-week time for me to come to your home as a physical therapist and say, okay, I think you're doing really well. If you mentally feel ready, this would be a great time to trial going to Dr. Rhee's office. It's not going to go over there. Thank you. Going to Dr. Rhee's office, because then you can say, okay, I'm just going to one place. Right. So kind of that mental aspect of, I just want to feel confident what I'm doing. Would be a great opportunity. Did you want a little water? You can have a little water.
Well, I think also, so because my work as a chiropractor, when you're laying on my table, regardless of the position that you're in, you're going to be completely relaxed. And when I do introduce the actual adjustment, you're going to, there's some people that tense up a little bit more than others. And so one of the biggest concern that I, again, try to reiterate to patients before they come in, I go, well, can the sutures can obviously open back up.
Right. And so that's where
that's my biggest thing.
Are you cleared to,
correct,
which would be, the combination of like if
I'm
working in concert. Yes. So I'm working in concert with your midwife or your OB. Well, obviously not a midwife to do the procedure, but whoever is clearing you, whoever is, surgically, that's what my PT brain is thinking of is because we're active in wound care. Like wound care is something we're trained in. So I'm going to say, okay, let's work together on this. But a lot of times the hospital wound care is going to be just like, do you need a wound vac or not? Like, is this really bad that you need to be in the hospital? Or is this like, you're kind of okay?
Like you just need time.
You just need time. It's like, if you just need time, then I'm like, okay, let's manage this together.
Yeah, correct.
So
which I think that's the beautiful part about you going to their home.
Right.
So that they don't feel like
they're just stuck.
Like, what do I do? Like, it's not a hospital situation, right? But I feel like I need a little extra support. So I love the fact that you can do that. And then in between that time, right, when they are feeling like, okay, I'm strong enough, I can sneeze and I'm going to be okay.
I can hold my baby and get off and off the couch and feel kind of okay. I can wear the binder sometimes, but not all the times. Those are the things. Then it's like, okay, let's integrate this in, because it is really important, in my opinion, for C-section recovery to be looking at the whole picture, like you said, of what is your lymph system doing? What is your nervous system healing doing? Because you're going to heal better if you're in, just like with any surgery, you're going to heal better if you're in a positive state than if you're anxious or nervous or whatever.
By the way, he is reading my favorite book.
This is so cute.
Just so you know.
Sorry,
I've had that
break,
forever.
Commercial break. Let me see something. I just want to see something. So this is a Dr. Seuss.
Yes. Inside, You're Outside, I think it was called, right? Yeah. And it's my favorite book. And I used it for many, many years. I've had it for many, many years. And I used it to teach kids about their body.
I love that. Yeah. It has the senses in here. We're on smell, hear, taste, touch,
everything.
sight.
Yep. Sensory, motor, skeletal, circulatory.
Yeah, it had the spinal
it's got all kinds of stuff.
I'm gonna have to look this up.
It's one of my favorite books. And so maybe a promotional thing. Great book for kids if you're trying to teach them about books, about bodies.
I'm sure this could be an Amazon find.
I'm sure. But yeah, I've had it for many years, and it survived many little hands.
Dear God, please don't be the hands it doesn't. So when it comes to that timeline too of where even the binder, when you mentioned binders, so I definitely have like a protocol or opinion or clinical, support on that.
Yeah.
Do you feel like you have things that you recommend or not so much?
I don't. I would say right now I really don't, because I used to just for that kind of care.
Relax, please.
I would send them out. Right. I'll refer them out because that's just out of my scope.
Yeah.
So I did work with a center, a PT center, and also a massage center that was solely. This is obviously in LA. I don't have that. The massage center, and I miss them so much. They were amazing. They're called Sparrow's Nest. I'm gonna tag them. They were so cute. So the owner's name is Sparrow.
Very LA.
And she just had an amazing vision to create this like sanctuary for pregnant moms and postpartum moms, and it was just a massage center, but they had all kinds of services, and I'm hoping that I can find something like that here as well. They were great. So I've known Sparrow for probably, I don't know, I think probably at the time 10 years before I moved out of LA, I would say. So they did a lot of that scar tissue work for me, right, which is not what I do. In fact, I have a patient right now, and she's pregnant and ready to have her little baby, and she's really hoping for a VBAC, and but she had some other scar tissue on her abdomen, not just from a C-section, but from
other
her previous
surgical procedures and something.
And so she's got double scars, I guess you can say, in her abdomen.
Sit back a little bit.
And I think she would have really benefited from Sparrow's services. And here she's going to I think just a conventional massage center. But I guess there's like a person who is familiar or is trained with like pregnancy care, but I don't know. I don't know the details.
So I agree when when it comes to massage, myofascial release, management of the scar tissue and all of that it does definitely a qualified person. Revisiting with the binder conversation, that is where I definitely so I will often, if you've had a C-section in the hospital, they give you one, they discharge you with one. There's a couple that are a little bit more articulated. So like the bands, I don't know if I can use this book to explain it, but like this part that goes around you, so like the part that goes around you is like split a little bit more, because it gives you more specific
like
pull or tension or support. Does that make sense?
I see.
So it's closer to like a belly binding situation, but not a belly binding situation. So that will be sometimes I'll say if you want to graduate to that, and that's a good option. And I usually give moms just the understanding or the guideline for afterwards, after C-section, I want you to use it like it's a hug to give you just enough support, but not so much that you feel downward pressure into your vagina. So no prolapse symptoms, none of that.
Okay.
If you start to feel that, you either loosen it or you take it off, and then you're trying to graduate yourself to using it less and less as you're going farther and farther out from
I'll have to get more familiar with that.
Does that make sense?
Yes.
Because it's basically just that graduated compression and functional use of the core with your pelvic floor.
So then
that's usually within that like 6 to 8 weeks. So we're talking 6 to 8. Okay. You know, acute. Got it. We should be done typically with the binder.
Sure.
By the time for sure that your wound has healed. Nope, I'm not right now. Thank you. You can read in your brain and your mind. Because you should be, by the time it's healed, the support should be coming from your musculature and your support of that versus having to rely on a binder, right? It may feel wobbly, it may feel not great, but we don't want to have an issue there.
I mean, I would also think,
get off of me. You need to go sit on the bench.
I would also think, thanks Braxton.
Thank you
for showing up. I would also think as a chiropractor, then as you're talking about the binders, you know, in any kind of scar healing, right? Scar tissue healing.
Yes.
Okay.
Exactly.
The way I see that also is as a chiropractor, I always talk about all the soft tissues has to anchor somewhere.
Yes.
Right? Mm-hmm. So for me, okay, then the hardware, which is the hard tissue, which is the pelvic bone, the spinal column, all of those soft tissues, tendons, ligament, you know, muscles, but also even the organs, the way it sits inside,
the visceral part.
The visceral part of it has to be anchored properly. And if your pelvis is not properly aligned, if your spinal column is not properly aligned, the chances of that scar tissue just kind of solidifying in a poor dysfunctional state, and then that scar tissue keeps topping off a bunch, like layering off on top of it. Over time you're going to have some more issues, especially if you're thinking about like VBAC.
So then we go into, you know, having, like you said, the management of the movement of the pelvis, what that's like, so that as you're then building the muscular coordination on top of that, it's built on more of a solid foundation or more of a typical foundation that we would want. Then when it comes to after the fact, so they're, you know, 8 weeks, 2 months, and then let's say like 1 year out of postpartum. Hey, look at me. I need you to stop with the car, please. Stop.
People have to be able to hear us. Hopefully you guys can all hear us.
Hopefully you can hear us, because I'm like trying to talk. I'm like this. It's going
to be an interesting episode today, for sure.
Overpowering the background noise. Okay, at the end, I will give you a minute. Look at me. Look at me. At the end, I will give you 1 minute to say whatever you want, but I need you to pause until then.
Do you understand? This is mom's life. And so
do you understand? Do you want that or not? So when it comes into like the next year, right? And then that's where you're saying, okay, so we have, hopefully are in a little bit better foundation as we're just rebuilding. That doesn't have to be perfect, but you'll also feel better.
Oh, 100%.
Because so many people feel like, oh, that alignment or that, you know, the way I'm moving, it's been like that since I gave birth. So if we can kind of do some of that support earlier on, then you can try it out. You can live, and then you can come back if you need to.
Well, I mean, even if we're not talking about C-sections, or even like I'm just talking just pregnancy, overall, you know, one of the go-to saying that I have to my patients, and they're not pregnant, but they want to get pregnant, I tell them, can you give me a good solid 6 months of care before you think about getting pregnant? That would be great. It's ideal. Does it happen? Not always. But same thing with C-section, right? Once the tissue is starting to kind of scar over and they're becoming a little bit more stable, I would want them to work with both a passive practitioner, which is chiropractic, or even massage, and then an active care,
yes,
which is
right.
physical therapy or even
connecting with what you're
Mhm.
actually doing with your body, especially if
Correct.
it's like then in
Yeah.
labor prep eventually
Yeah.
and that kind of thing.
Yeah. And then we can't forget about the neurology of it as well, right?
Yeah,
so
absolutely.
Again, like alignment wise,
yeah,
if the alignments are not great, then you're not going to optimize that neurology.
right. And it can't communicate
and it can't
to the muscle to do what you're trying to have it do.
Right.
Or in the fertility space, like you were saying, those things can't move together with those organs to support the fertility environment to improve your chances of conception.
Yeah.
And which is a whole other, conversation. But we're so close.
We're so close.
We're really close. I'm going to need a red light room and sauna or something after this.
You can always go to massage.
I actually learned about a new mobile prenatal massage therapist.
Oh, really?
I'm trying to meet with her sometime in the next couple weeks because she's new to the area.
Okay.
So I was like, that would be perfect.
Well, we'll definitely, I will love that.
I know.
Too,
That's what we were talking when you were saying, like someone who's specific to that. It's hard to find sometimes.
Yeah.
Not like a massage MD or a basic, massage therapist.
Yeah.
Okay. So yes, when it comes to, is there anything else I feel like?
Well, so
C-section
I have a question for you then.
Yeah. I would share.
Obviously for me, they have to come to me and they have to be somewhat pretty stably healed. Because if you can't sneeze or cough,
1,000%. You can't add that pressure, that abdominal pressure, then you're in trouble.
So I'm just thinking for you, how soon like the services that you provide at home, are you able to provide them pretty quickly soon after?
Yes. So when it comes to, like we were talking about with lymphatic drainage, manual techniques, myofascial, not to the specific scar itself, but adjacent tissues, the back, the hip, those kinds of things, I can be in that arena around 2 weeks, really. And then also, since we're seeing baby as well, feeding positions.
Yeah. Oh, while you're healing. Yeah. Huge.
Side lying, being comfortable laying on your side. What does that mean? How does that support healing? But then also like your back expansion and that inhale, exhale of just having that, because that's all, a surgical recovery where your brain kind of thinks, it doesn't realize on most of the levels, it does not realize that, this is a birth experience, this is a happy experience. It just thinks that's a surgical wound. Anytime this moves, anytime something around it moves, it sends a pain signal to your brain. So a lot of being able to like manage that would be happening at 2 weeks. So I could go see someone and say, okay, are you feeling comfortable with where you're holding? Even if you're bottle feeding, if you decided not to breastfeed, okay, that's your decision. How does that even work? Because if you're doing a side lying, you
have a baby.
You've
got a little baby right there in my basket.
This is kind of a big baby.
Well, that's what I use to teach my little ones what I'm going to be doing.
Maybe it's head. Them. Maybe that's why I think it's big.
I think, It's
how old
do you think that baby is?
How old is this baby? What's how old do you think this baby is, Braxton? 1. Okay. I think he or she is 8 to 9 months.
Yeah. I was going to say like 8-ish.
Yeah.
Maybe even 6, depending on the child.
Sure. Okay. So even if you're doing a side lying feeding with baby and you're doing a bottle, which is what I instruct a lot of the time, I should do it this way
that
so
way.
People can see. So bottle is here, baby is here. I'm actually going to have my knees up a little bit higher. But even that, their butt is on my belly button.
Well, and also they can kick you.
That's going to be right there. I know. Also. But I always say, if they're kicking you, their butt is not on there. If you can, if
feel
they can feel their feet, they can push. So you got to actually get their butt on your belly button, which people are like, but it is. And I'm like looking at them and I'm like, they're going to do this. Like this is So anyway, so even if we're doing a bottle feeding, I'm going to be able to help support you with either different positioning or understanding why you kind of have to position that differently so it's not directly on your C-section scar. Are we giving it to the caregiver, spouse, whatever? And those kinds of conversations are what we would have in, you know, in a home visit.
Would you have them belly to belly at that time? Sideline?
Sideline probably.
Okay.
And then even if they were belly to belly, like on, I just probably wouldn't have it. I wouldn't have them fully reclined. I'd have them like halfway.
Got it.
So part of this is a great question, because if this is the other thing about C-section recovery, when you're in the hospital, you have the reclining bed. Yeah. Right? You don't, you may not have that at home. Right. Or at least not easily. Yeah. So what I always say is, I know it feels, initially it feels really intense to allow yourself to recline in the bed. Yeah. Just go until you feel like just before that uncomfortable part. Yeah. And then you're really going to practice that full inhale and exhale and inhale and exhale. And then as you're getting better, you're reclining it, and then you're getting to fully supine or on your back. Yeah. Because most people post C-section with that lower scar in that area that's always shortened. Yep. And they're never out of how I'm sitting right now. Right. They're never out of this that position or a sacral sit. Yeah. So it's going to heal really, really close or really, really tight, because they're never here. Yeah. And then even when they're cleared to be on their tummy, I'm like, baby's on their tummy. Yeah. You can be on your tummy. Yeah. When you're cleared. Yeah. Like, you guys can follow the similar thing. Right. Because that's going to help with expansion into your back. It's going to help with expansion of the scar. Yeah. You know, those are things that I'm thinking about that don't even necessarily have to do with me touching them or touching the scar even. Yeah. 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 So that's what, you know, that's how I think of it with why I'm there at 2 weeks. And people are like, that's early. And I'm like, but we're doing so many other things that are going to really help you.
Oh, I mean, I would also think just from the mother's perspective, how overwhelmed they're going to be
1,000%.
With like a baby, and then you can't really move around much. And so having that extra knowledge and resource and help, even if it's just for 1 hour,
exactly,
to understand, set you up. To get you. I mean, because I've seen moms like on my table, and they're like maybe a month and a half out, and they have a C-section, and I'm like, wait, do you want to like get in and out of my bench the way you just got up?
Yeah, you're like this.
And I'm like, don't do that. That's like, don't whip your body up off my bench.
He would probably be a really good demo of that, but we're not going to do that because he would knock the cameras over.
Or even just my patients, you know, I would love to talk about diastases at some point too. Same thing with that. Because that
can still happen regardless of, it does still happen regardless of whether you have the C-section or not. Yeah. Pregnancy before that requires the tissue to stretch. Right. It has to make room. Right. So, that's a great topic. Yeah. Eventually. That might be a good follow-up because we're in C-section and then we can go into that.
So that was probably the biggest thing for me. It's just like, can they get in and off of my bench? Can they move around?
Please be careful. That's exactly what I didn't want to happen. We are 1 minute out, Braxton. We're 1 minute out. I'm going to let Dr. Justine finish her thought. Look at me. But when she's done, you can come and do 30 seconds. Okay, go ahead.
So what was I saying? So so I think just getting in and out of my benches, right? Getting in and out of a car. Yeah. Right? Just getting in and out of anywhere, in and out of your bed, right? But I think my biggest test is like, if you sneeze, do you feel confident that you'll be okay?
Yeah. You're not going to open a stitch. You're not going to pee your pants. And if you do, where are we at with the stitch is going to be probably sooner, maybe for some people than the urinary part. But
I do recommend sometimes if they're in dire need of getting adjusted, you know, anywhere from like breast tissue up level.
Oh yeah.
When I work on them,
you need to be over there.
When I work on them on
like neck and head.
Yeah. Neck and like upper back, I'm very confident they'll be fine. Okay. It's just that when I see like middle back to like lower back and then like pelvic area,
Yeah.
it's just a little tricky because of position that I have to put them in when I adjust them.
Not the adjustment itself, but the position, which I agree with.
Yeah.
I agree that it's not worth.
Yeah.
It's not worth.
Yeah.
Having that happen, negatively, and almost you might get overlap from adjusting at the head and the neck, where they're feeling like the most intense part is maybe right here. They could still find a lot of nervous system relief.
Yeah, 100%.
From just the head and the neck.
Just the parasympathetic side.
Yes, exactly.
Which is that rest and digest. Yeah. Right? It controls everything, literally almost everything from upper neck down. So I would say there are benefits of coming in, even if you feel like you're not confident. But the confidence comes, like, it's just is relative to the lower body. Yes. Right. So upper body, can really help just to help you deregulate and kind of just be in this, like, I want to be able to like heal and relax. And so we can do other things. Yep. So I'm not saying that you can't get chiropractic care at all. Sure. But yeah, but what I'm saying is, like, lower back region adjustments, we may have to wait until you're healed up more. Yeah,
which comes fast. All of a sudden you're like, what happened? Yeah. And then it's 2 months, and then you're like, it's 6 years, and you're like, they're still not listening to me. Same as at 2 months. So we've hit our
it's a great conversation.
Time and our level of capacity.
I do enjoy our conversation. I hope patients, and not even patients, just anybody, finds our conversation informative, right? But also practical to be able to,
like the real terms that a mom would use, actually what you're experiencing. If you're watching this and you're like, that's how I felt at 2 months postpartum, or that's how I felt at 2 years postpartum, whatever that may be. So thank you so much for checking out our YouTube channel, and we will see you next time. Yeah.